In terms of how does biomechanics or motor control influence the area of clinical practice of prosthetics and orthotics? So I think one potential way that those two fields can influence clinical practice is to at first help to explain or understand what exactly clinical tests that clinicians use are actually testing. So what function, what capacity are these tests, what construct are these tests actually testing from a biomechanics and motor control standpoint? Because quite often they're developed without any kind of movement science data supporting them. And then I think the other application, or a very similar application, could be simply the development of clinical tests based upon sound biomechanical or neuromechanical experiments. So in the next few years, I guess, if I thought about what new technology or research directions we'd like to see furthered to improve or advance rehabilitation, one thing I think that's really important and necessary is to develop tests that can be used in the clinic that are a little bit better at predicting not just who needs interventions, but more specifically what interventions those individuals need and why they need those interventions. So instead of just saying some individual or a particular patient is at risk for a fall, if we're able to say through a handful of clinical tests or a battery of clinical tests why that individual is at risk for a fall, then we can start assigning more patient-specific treatment plans that address task-specific needs for those individual patients. I guess then in addition to that, it would be helpful if we had a little bit better understanding of some, let's say, classic or straightforward or well understood neuromechanical principles and their relationship to balance. So a couple of examples of those could be the startle response. So what type of contribution, positive or negative, stabilizing or destabilizing, does a startle response have to balance and falls or recoveries from perturbations? And similarly, the role of interlimb coordination. Do limbs have to remain coupled? Do they need to become uncoupled in order to successfully recover from perturbation? So I think answers to those types of questions are important and can help not only guide what interventions people need, but also guide the development of new interventions based on sound neuromechanical principles.